In this video, we are going to talk about the supraglottic airway, which we call the laryngeal mask airway. Now, the laryngeal mask airway comes in different sizes, starting from 1 to 4 and 1 to 5, and this is the size 4. If you zoom it, this is size 4, and it is for the category of the patient which weigh from 50 to 70 kilogram. So, this is a supraglottic airway which is used in elective and emergency procedures in the operation theatre, and also if there is a difficult intubation in any patient, then we use this laryngeal mask airway, very famously known as LMA. And it has got now four very important parts. One is the connector, where we connect the ambo bag. One is the tube itself, which is a plastic tube. It has got a straight line. It has got a number starting from size 1 going all the way up to the size 4, and here this is a dotted line, actually, which is a benchmark how to place this laryngeal mask airway in a patient. Now, another very important thing on this laryngeal mask airway is the capacity of the volume of the air. Like if you zoom it here, this is written 30 ml. So less than 30 ml should be injected to inflate this very important cuff. So this is connected, this is the tubing itself, and this is the cuff of the laryngeal mask airway, which is inflated with the help of this pilot balloon. Now, if I inflate this laryngeal mask airway, it will be something like this. I will have to connect a needle. I'll connect a syringe. This is a lower lock. I'll have to push it inside. Then you will see that there will be an air. So I pressed 10 ml. Now I'm pushing in 10 ml more, and let me do just 5 ml more. So this is how it is inflated. This cuff is inflated. Actually, when we pass the laryngeal mask airway in any patient, this part of the laryngeal mask airway sits right on top of the esophagus, and this part which has got the whole of the this tubing, this sits right on top of the glottic area. So this is glottic area position, and this is it's actually closes the esophagus. So before we pass it, we'll have to take out the air completely. I'll remove this air from the cuff. This is very important that whenever you are to inject the air, you will have to deflate it completely. Now we apply gel on the posterior part of the cuff, not the anterior part. We apply gel on the posterior part, then holding our finger, index finger, right here, we just open the mouth of the patient, and sliding it with the hard palate, we insert it into the patient's all the way up to the glottic area, supraglottic area. Once it's there, we just remove our finger and we inflate the air as I mentioned before. We'll inject at least 25 to 30 ml of the air, so it will be placed over there. So now once this laryngeal mask airway is positioned in the supraglottic region, we will connect the connector with the ambo bag, and then we can actually give the breaths to the patient. But before that, obviously we are to inject air in the cuff. We'll inject how much air? First we will attach the syringe to the lower lock. We'll give 1, this is 10 ml, again this is 20 ml, and these are 25. If you zoom it here, this is 4 size, number 4, and it is less than 30 ml air needs to be injected. So the cuff is dilated. This is located right above the glottic area, and now we can attach the ambo bag and we can give breaths. So another use of the laryngeal mask airway, we can connect this thing with the manual ventilator in cases of the anesthesia. So this is a very important purpose of the laryngeal mask airway. Now let me deflate it. So just in order to summarize, laryngeal mask airway is a supraglottic airway. It is used in emergency and elective procedure to. This is not a definitive airway. This is done in cases where you are going to carry out the short procedure on the patient in the operation theater, or in cases of the situation where you are not able to pass the endotracheal tube. It has got one is four part. One is connector, one is the tube itself, one is cuff which is inflated with the air once we have placed it in the supraglottic region, and the last one is this pilot balloon which puts in the air in the cuff. If we compare it with the endotracheal tube, this endotracheal tube is a 7.5 millimeter, 7.5 internal diameter. This is the entire length of the endotracheal tube, and it is actually engraved over here 22 centimeter, 24, 26, 28. It has got one connector part which is attached with the ambo bag, and it has one plastic tubing of the endotracheal tube. One is the cuff where we inflate at least 10 around 10 ml of the air. It has one this radiographically opaque line which is there to actually check the position of the endotracheal tube on the X-ray, and we insert the tube up till 21 centimeter mark on the incisors or the lips. So these two marks, if we focus here, these two marks, these are actually to sort of indicate that our tube has entered into the trachea and is past the vocal cords. So, and this is the internal diameter which is 7.5, and this is the outer diameter which is 10, but we are more concerned with the internal diameter. This is written that oral and nasal because it can be inserted both orally and nasally. And this is cuff which we inflate with the help of this pilot balloon. So if I inflate it, it's again the lower lock where I just first fix the syringe and then I inject this much of the air. So now if you compare this cuff with this cuff, this is a definitive airway. It will not let the gastric contents go to the lungs, but this is not a definitive airway. This is just a way of passing air or giving breaths to the patient where we are not able to pass the endotracheal tube. So both laryngeal mask airway and endotracheal tubes are very important when we are talking about the airway management in any patient. One should be expert in passing these both airways. So if the last thing, if you notice this dotted line, it's an indicator that you need to keep it towards the patient nose side. So it will be on your side, your finger will be here, and then you will be trying to say this is the oral cavity. You will go through the sliding with the hard palate all the way down to the supraglottic region. This part will be obstructing the esophagus, and it will be supraglottically. So this is the laryngeal mask airway and endotracheal tube.